I'd like to introduce Dr. Emily Chu. She will discuss the long-term effects of the phase 2 ciliary neurotrophic factor treatment for the treatment of macular telangiectasia.
Thank you, Linda. Members and guests, it's a pleasure for me to present data on behalf of the MacTal Research Group on the long-term effects of the phase 2 ciliary neurotrophic factor CNTF treatment for MacTal type 2. This started as a program that we sponsored by the Lowy Medical Foundation, and it's a multi-nation study that looked at natural history. And after a while, we actually learned a great deal about this disease. Seemingly, it's a vascular disease, but with more studies through our natural history and also through our donor eye program, we learned that this indeed is more than just a vascular disease. This particular slide shows the pictures of the patient who passed away, and we've done some work looking at the bimentum, Mueller cells. It shows that the presence of Mueller glial cells in the macula in the periphery, but definitely missing in the area of the MacTal area. In addition, we see abnormal neurons, RPE, and vasculature as well. So this is a neurovascular glial degeneration, not just a vascular disease. There's a rationale for using CNTF. The neurotrophic factors have slowed the photoreceptor cells in animal models of retinal degeneration, and CNTF has been very effective in slowing cell death in animal models of outer retinal degeneration. And in addition, we had a neurotrophic factor given to a mouse model that mimicked the MacTal-like study, and this again had functional and anatomic effects on the photoreceptor cells and was rescued, but no effect on the vessels themselves. And this is the CNTF encapsulated cell technology. This is a cross-section of the protective capsular environment in which there's an immunomembrane surrounding this. There's oxygen and nutrients are allowed out, whereas the therapeutic factors can come out and it's protected from immune attack from the body. And this is now inserted in the eye and anchored to sclera with a small suture. After a successful phase 1 shown it is actually very safe, we went on to a phase 2 study. The primary outcome is the change from baseline ellipsoid zone area ISOS loss as measured by the SDOCT on FOS at 24 months. We had secondary outcomes which include visual acuity outcomes looking at visual acuity loss, best corrected visual acuity, 15 to 10 letter loss, and also monocular reading speed as well as microperimetry. We had 99 study eyes, 67 participants, 32 were bilateral and 35 were unilateral, and almost half were randomized to device. There were almost 60% were women, and the average age was about 64. And the break that we measured was 0.62 millimeters square. And when we looked at this, we were looking at the results, looking at intent to treat versus a per protocol analysis. And intent to treat includes all participants who were randomized no matter what happened. The per protocol excludes those who are ineligible or had a protocol deviation with the OCT measurements. You can see here the primary outcome was a change in EZ break at 24 months compared to baseline. You can see at 24 months, the ITT, or the intention to treat, had a difference that was statistically significant on 0.04. When we actually subtract those patients away who actually did not meet eligibility or who developed nevascularization during that course, you see that it's 0.03 is statistically significant. So we did have a primary outcome that was statistically significant different. A secondary outcome looked at an increase in the EZ loss by 35%. Again, this was statistically significant only with the per protocol analysis. For the ITT, it was on borderline. As we expected, visual acuity had no change between the two groups. We follow these patients, and the usual loss is about a letter a year, so it's very hard to find any changes on 2 years of this particular disease. What's important is that no subject lost more than 15 letters. At 24 months, 3 CNTF patients were treated had a loss of more than 10 letters, while the sham group did not have that. So I've shown the 24 months in the past, but now we have 3-year data showing that this has persisted. With 92 eyes still present, we had 3 study eyes who, during the course of the study, had passed away in 2 patients. And we also had some loss to follow-up in the extension study. Not loss to follow-up, but patients couldn't come back at this point. But we do gather the patients back. So at 4 years, you can see that the curve is coming together, and this was due to, in fact, a great outlier in the patient that was treated. This patient had CNV, or nevascularization. When we exclude that patient, there was some difference, but still not statistically significant. I'm going to tell you a bit about a particular lesion that we see. It's a hyperreflectivity. It's called OCT hyperreflectivity, which looks either at a mounds of hyperreflective material in the internal from the RPE, or linear oblique hyperreflective streaks that we see, with and without the shadowing of pigmentation. This is one case of hyperpigmentation or hyperreflectivity, and another one, and as well as this one. These patients behave very differently. When we did these analysis looking at these patients who had hyperreflectivity, there was no treatment effect. However, if you look at patients without OCT hyperreflectivity, there was a statistically significant difference. We don't understand what this lesion really means. It could be intraretinal vascularization. We are seeking to understand this a bit more. And finally, we looked at the microperimetry. We looked at this with a microperimetry map. We overlaid this over the OCT images, and this is the combination of the ellipsoid break and the combination. There's high correlation between the functional and the structural changes. It was highly correlated at 24 months, at R of 0.85, and when we looked at the differences at 24 months, especially with the per protocol analysis, that there was a statistical difference between the functional changes. The reading speed was different at the 24 months. There was more preservation with those who had the CNTF implant, but at 24 months after that, we did not have any persistent beneficial effect. We did have problems with dark adaptation in reports. Meiosis was one of the issues that we saw with this patient. These patients. So in summary, we have a beneficial effect of CNTF. We have to understand what the OCT hyperreflectivity really means, and we're now doing a phase 3 trial. Thank you very much for your attention.
Thank you, Emily.